Hi there, it is May 2024, and that means it is Asian American Pacific Islander Month. And in my heart and in my mind today, I actually wanted to speak to other Asian American and Pacific Islander patients out there, or those that are navigating the healthcare system. Actually, this extends to Asian people around the world. Oh, there's a lot to unpack. But I wanted to give the reminder, right? In our culture, we are never supposed to challenge authority. I wanted to remind you that it's completely okay to have questions. Coming in there, your appointments with a notebook and taking notes. It's completely okay to ask your doctor questions. If you have more, please remember that you need to muster up some energy to speak up, because what's on the line here is your health and not getting access, right? I know in an imaginary world, we would definitely just have our diagnosis right away. We would know what's wrong with our body. We wouldn't be dismissed. But in the reality we live in today as Asian people, it's easy to dismiss us. And it also doesn't help that in our culture, we're never supposed to challenge authority. Also, there's the stigma that, young people don't get diagnosed with lung cancer, where actually the younger people are outside of the screening guidelines. So if you're young, if you're Asian American, it's actually institutionally, it's hard to get diagnosed with lung cancer even though you have it. So I wanted to remind you that you got this. I know it's hard. I don't know what kind of institution you're in, what kind of hospital, but if you start taking ownership, bring in that notebook. I know it's really overwhelming, but begin with asking questions, coming in with more information, writing down your symptoms. I actually write mine down on paper and I write it down on my phone. Whenever the symptoms come up, for example, like my back hurts, or if there was chest pain that I experienced, or if I'm coughing really bad for a certain amount of time, I would write down the time, and then I have all of that. Even though I've been diagnosed, I still write about all the symptoms that I experienced just for myself. Like, it feels good to have ownership of my own body and being connected to it. So yeah, if you have any questions about getting diagnosed with lung cancer, or if you are experiencing any symptoms, feel free to comment below. And also, another reminder is that you don't have to stick with just one doctor, your first one. I actually went through 3 healthcare teams before I found the right one that was for me. It's completely okay to seek out different opinions and then make an educated choice based on who feels good to you and who you think could take care of you best. All right, guys. Thank you so much for listening this far, and happy AAPI month. I want our community to get the best healthcare out there. Bye, guys.